Fox 17 News at 5 starts right now.
First at 5, with every surge in COVID cases, hospitals are losing more and more staff.
And now, similar to the state's teacher shortage, the industry is doing everything it can to keep frontline workers on the front line.
We are having to continuously rally the staff over and over again.
Chris Mitchell, Executive Vice President of the Michigan Health and Hospital Association, has seen this happen before. At the end of each COVID surge, as patients fill scarce hospital beds, something concerning happens.
What we've seen is early retirements. We've seen some healthcare workers leave the acute care setting and go to home health or other industries where they can use their talents and not feel the stress and strain of dealing with this pandemic 24/7.
It's not too different than what's happening to Michigan's crop of teachers, but with healthcare workers at the front of the front lines, it's a troubling trend, to say the least.
There's a limited number of healthcare workers. The really difficult thing about this pandemic is that it's always hitting somewhere at some time.
And right now, it's hitting the South. Hospitals and states there are showing the worst levels of critical staffing shortages, according to data tracked by the CDC. That's it. That's the tweet, said a post from the University of Mississippi Medical Center that included a graph showing their rise from 9 COVID patients on July 6th to 44 patients just 2 weeks later. Florida is reporting 13% of their hospitals are critically low on staffing, a 4% rise from just a week before. In fact, 14 states reported critically low numbers in healthcare workers this week, luckily Michigan not among them. But Mitchell worries fatigue from the last year and a half may put us there soon.
Particularly in some of our smaller communities, these folks are caring for their friends, their neighbors, and that has a profound impact on individuals.
The MHA has talked with their members about more mental health services for hospital staff, hazard pay, retention bonuses, even paid sabbatical leave and student loan forgiveness. But as beds fill up and less than 1% of hospitalizations nationwide are among vaccinated people, Mitchell knows the best way to help hospital staff is to just not need them.
We know our best defense against overwhelming the hospitals across Michigan and the country is to go out and get vaccinated.
And as of July 31st, 5 Michigan hospitals reported critically low staffing, according to the CDC. That data did not show which hospitals those were.